Greetings, viewers. So this is a continuation of our class uh, in Plasmodium. So I want to continue from where I stopped in the previous class. In the previous class, I uh, tried to explain the life cycle of Plasmodium falciparum, talking about the injection of the sporozoites by the vector, schizogony in the liver, schizogony in the red blood cell. I also talked about the formation of the micro and the megagametocytes from the merozoites, that is merozoite 2, then the fusion of the micro and the megagametocytes to form a zygote, which now metamorphoses to the oozes, and inside the oozes you have many sporozoites that when mature, they break from the oozes to be spread to different parts of the body of the vector. Now, another way to capture the three main events that occur within the life cycle of the parasite is putting it this way. The first one is schizogony, and they will have what they call the pre-azo-erythrocytic schizogony, pre-azo-erythrocytic schizogony. So this thing means pre-azo means schizogony that occurs outside the the red blood cell, and since it's outside the red blood cell, in this case now it's within the hepatocyte. 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 What do I mean by hepatocytes? I mean the liver cells. The hepatocytes are called the liver cells. So this kind of schizogony that occurs in the liver cell is called pre-azo-erythrocytic schizogony. So it means outside the red blood cell. Then the second one is now erythrocytic schizogony. Erythro erythrocytic schizogony. When we talk about erythrocytic schizogony, we mean the type of schizogony that occurs within the red blood cell. Then, of course, we have the syngamy. Syngamy is when the micro and the mega gametocytes unite together to form a zygote. The sporogony, the division that occurs within the oozes, is called a sporogony. The sporozoites multiply into hundreds of thousands of that infective stage, which will be spread to different parts of the body. So this is that about the life cycle of Plasmodium. Then talking about the pathology, we are already familiar with what this parasite can cause. The person may begin to experience a fever, as a high temperature, then weakness, general body malaise, you know, uh, yes, general body malaise, headache, and so on and so forth. But the aspect of this disease that is deadly is when it gets to uh, the level where they pack themselves at the capillaries of the brain, resulting to hemorrhage. That is when they apply pressure to the capillaries of the brain. This now may result to the breaking of the capillaries, and blood may begin to drip into the other parts of the brain. This may now result to cerebral malaria, and it's very difficult to treat. So, like I mentioned at the introductory aspect of this teaching, I said this parasite is still being rated or being adjudged as the number one killer parasite all over the world, not just in tropical Africa or in the whole of African nations. All over the world is still being adjudged as the number one killer parasite, and that is why we should know how to prevent this disease, and that leads us to professional control. One of the ways we can prevent this is through the use of insecticide. Of course, insecticides kill this vector. And once the vector is dead, of course, the vector is the host. Once the host is dead, then the parasite itself is also as good as dead. So we should make sure that if you're living in an endemic area, then make sure you're using insecticides. It will go a long way. Then cover your body very well. If it means wearing stockings, covering your leg and your hand and every part of the body, especially for children whose immune system is still very low, it's important to make sure you cover them. And whichever other method you can use or you can employ to prevent this vector from reaching to your body, because it is only when the vectors get to your body that they cannot transmit the parasite. Then, in terms of treatment, how can you treat this parasite? Now, there's this popular drug, it's called ACT, atomycin combined therapy. Now, people have abused malaria drug. When people are given drug, they don't complete the treatment. Somebody is expected to take a drug for 3 days, the person will not take it for 1 day or 2 days, not knowing that what they are doing is that they are causing the parasites to develop resistance for that particular drug. So by the time the person takes that same drug next time, it will not have effect. And that is why researchers are coming up with different types of drugs that will be more potent in the treatment of malaria. But if you hear medical doctors speak, they will tell you that one of the major challenges that they are having when it comes to the treatment of malaria is this development of resistance, and people are the cause. People who take malaria drug are the reason why this parasite is developing resistance. So, but this ACT is a good drug. There's also a drug in form of injection that is called MR. So MR is also very effective. So you can use these drugs. This one is tablet. You can use these drugs for the treatment of plasmodiasis. Remember, the name of the disease is plasmodiasis. Then diagnosis. In terms of diagnosis, there are two different. There are many methods, of course. The molecular method of diagnosis is what I don't want to go into. Is somehow advanced, but then there are two basic methods that are being used in different parts of Africa. We have the kit method. I will have the microscopy. You know, you can use either of these method to diagnose the parasite. When you get the blood sample, you put it in the kit and it begins to read. If the person has plus one of the back of the parasite, it will show. If it's plus two, it will show. If it's plus three, it will show. And if it's plus four, then it will also show. Then for microscopy, one can use the thick film or thin film, especially when you want to ascertain, you want to know the species of the parasite that is causing such infection. Then, of course, you can use a thin film. So this is all I have to say in Plasmodium falciparum. Subsequently, in other classes, we talk about other parasites, possibly plate helminth, because I know we have exhausted majority of the protozoa parasites. Once more, thank you for listening. I still remain my humble self, Dr. Nkujan Uchenna. See you in my next class.